Welcome to EarCleaning. I have a question for you, my audience. Have you ever wondered how a blocked ear can return just weeks after a professional care cleaning? Well, in today's fascinating ear care case, we're going to look at a patient whose recurring ear blockage wasn't just caused by earwax at all. It was the result of a rapid buildup of dead skin that is linked to chronic eczema inside the ear canal. In this video, we are using a high-definition endoscope to closely examine and clean up the patient's ear while explaining exactly what's happening throughout the procedure. At first glance, the inside of the ear appears unusually shiny and reflective. That's because the ear canal is coated with a thick layer of keratin or dead skin, which sometimes reflects the light from the endoscope. Once this outer layer is removed, the view becomes much clearer, allowing us to safely continue the cleaning. This patient first visited our clinic several years ago after developing severe pain around the entrance of the left ear. They had already been diagnosed with otitis externa, an inflammation of the outer ear canal, and had received treatment from an ear, nose, and throat specialist. But while the infection improved, they were also struggling with severe eczema affecting their scalp and outer ear. During that first examination, the ear canal itself was relatively clear. The pain wasn't caused by impacted earwax or a blockage. Instead, it came from inflamed skin around the entrance of the ear, which had become irritated by persistent itching and scratching. After receiving treatment for the eczema, the patient's symptoms improved dramatically. For several years, they experienced very few problems, and the skin inside the ear returned to a healthy appearance. However, things changed when the patient returned after noticing that their left ear suddenly felt blocked again. This time, an endoscopic examination revealed a large plug of compacted dead skin completely filling the ear canal. Once the buildup was professionally removed, the patient's hearing improved immediately and the blocked sensation disappeared. Unfortunately, the relief didn't last. Only a few weeks later, the patient contacted the clinic again, saying the same ear had become blocked once more. Since the previous procedure had left the ear canal completely clear, both the patient and our team wanted to investigate what had changed. A closer examination revealed another remarkable accumulation of dead skin. The patient's eczema had flared up again, causing the skin inside the ear canal to shed much faster than normal. This new layer of skin had become tightly attached to the walls of the ear canal, creating another significant blockage in a very short period of time. To safely remove the buildup, we first applied a small amount of medical oil to soften the hardened skin and reduce its attachment to the delicate ear canal. Using specialized endoscopic instruments, we carefully lifted and removed the dead skin in small sections. Unlike a typical earwax removal procedure, this material was firmly attached to the surrounding tissue, making the process much more delicate. Every movement required patience and precision to avoid irritating the sensitive lining of the ear canal. Interestingly, the patient described the procedure as surprisingly soothing. Because the chronic eczema had caused intense itching deep inside the ear, the gentle removal of the dead skin provided immediate relief as the buildup was carefully separated from the canal wall. Once the largest plug had been removed, the eardrum became fully visible once again. However, another thin layer of dead skin had already begun forming around the circumference of the ear canal. We continued removing as much loose skin as safely possible in order to help delay another blockage and improve the patient's comfort. Although the patient's hearing returned almost immediately after the obstruction was removed, it's important to remember that this procedure treats the symptoms, not the underlying skin condition. Long-term management of eczema requires ongoing medical care, and the patient was advised to follow up with a dermatologist to address the root cause of the recurring skin buildup. One of the most remarkable aspects of this case is how quickly the blockage developed. In such a matter of weeks, enough dead skin accumulated to significantly reduce hearing and create a persistent sensation of fullness. While recurring earwax is common, this level of rapid skin buildup is relatively uncommon and demonstrates how chronic skin conditions can affect the ear canal. The patient's right ear remained completely healthy throughout this period, highlighting how localized eczema can sometimes affect only one ear. Cases like this remind us that not every blocked ear is caused by earwax. Conditions such as eczema, dermatitis, chronic inflammation, or recurring infection can also lead to hearing changes and require professional assessment. So, if you're experiencing muffled hearing, itching, recurring ear blockage, or discomfort, it's always best to seek evaluation from a qualified healthcare professional. Avoid inserting cotton swabs, hairpins, or other objects into the ear, as these can worsen irritation, push material deeper into the ear canal, and increase the risk of injury.
Till the sun's up Monday, we'll tell our phones, do not disturb. I got my straw hat, babe, and you can finally pull the tags on your Tommy Bahama shirt. Blue crush up on the 85-inch sound machine. When we wanna hear the ocean, I think everything we need is right here. And there ain't a palm tree in sight, but there's not a cloud in your blue eyes. If we need a drink, I'll be the bartender. I got a fifth of Patron and a blender, baby. Slipping on a swimsuit is overrated. We don't need a beach to get a half naked. Life's too short, let's not waste it, 'cause paradise is wherever we make it. Paradise is wherever we make it. Oh, this view of you, it's got everything I need.
Thank you so much for watching this educational ear cleaning and dead skin removal procedure. If you enjoy video about our health, endoscopic ear cleaning, satisfying earwax removal, and the professional ear care, don't forget to like, subscribe, and turn on notification so you never miss a future case.